Um, I am sharing my screen, but if it's easier for you to share yours so you can move the PowerPoint forward, I can take it down.
I don't know. I am happy to try it. I have no idea. I've never done it before.
Okay, well, since I have it up, I can just move it forward for you, if that's okay.
Okay, that's fine.
Okay. Actually, it'll start. So otherwise, mouse time is over. I know that trackpad time sucks. Yes. Don't love it. I'm still trying to figure out how much of my work setup I should bring. I just want to bring my mouse and keyboard potentially, or go. Yeah, I don't know. Yeah, kind of different things.
Are we still waiting for some more folks?
Yeah, I think let's just give it like one more minute and then we'll get started, if that's okay.
That's fine.
Okay, Maripat, if you want to go ahead and get started, and I'll just forward the PowerPoint for you.
Okay, great. Okay, well, hi everybody. I'm Maripat, for those of you who I haven't met yet. Happy to virtually meet you today. Thanks for making the time for this. I know how hard it is to make time for anything these days. So today we're going to talk about emergency medical assistance. Gwen asked me to talk with you all a little bit about this topic. which is a really tough one. So if you are or have been or will be handling these types of cases, I'm sure that you've run into difficulty before, and you probably will run into difficulty again. But hopefully I can tell you a little something new today that might help you in the future. So this is my contact information on this first slide. Please feel free to reach out to me. Our office is closed, of course, but we're working remotely. Calls to that number there still reach me here at home. And of course, email is good too. I am at home with 2 kids in the basement. I apologize in advance if they make an appearance at some point today, but the TV's on, so that might keep them occupied. But let's get started. So you want to move forward to the next slide, Gwen? All right, so as a real brief introduction here, emergency medical assistance is medical assistance for immigrants who are eligible for medical assistance in all respects, except that they have the wrong immigration status. Their immigration status makes them ineligible for regular medical assistance, and they have an emergency medical condition. Emergency medical assistance provides medical assistance coverage of the treatment of the emergency medical condition for as long as that emergency medical condition persists. Go on to the next slide, please. So it's really hard sometimes to even figure out if you have an emergency medical assistance case, because in order to figure out if you have an emergency medical assistance case, first you got to figure out if somebody's immigration status makes them ineligible, and then you got to figure out if they have an emergency medical condition. Both can be really complicated, difficult things to figure out. So I listed here some kind of key questions that we ask ourselves at CLS when we're thinking about whether we have an emergency medical assistance case, and that you all can ask yourselves too when you're trying to figure it out. So the first, obvious one is, what is your client's immigration status? And does that immigration status make them eligible for regular medical assistance? For the most part, there is a medical assistance option for almost everybody who has some kind of status or who's trying to get some status. There are some regular medical assistance options even for some folks who are applying for status but don't have that status yet. So once you figure out whether your client's status gives them some access to regular medical assistance that they are eligible for, and if the answer to that is no, then you can think about the other health insurance options that are out there for people. Marketplace coverage is available to lawfully present people. Medicare, there are very few immigrants who get Medicare, but if somebody is lawfully present and they've been in the US for a while and have some work history, Medicare might be an option for them. If they're working, of course, employer-sponsored coverage is potentially an option. The state pharmaceutical benefits program provides coverage to people for HIV medications, regardless of immigration status. So if what somebody needs is HIV meds, that's an option. If you run through all those options and it's just none of these are options for your client, then you need to think about, well, what's the healthcare that they need, and is there a way for them to get it without health insurance, right? Because that will always be the easier option than trying to get emergency medical assistance if there is a way for somebody to get medical care without emergency medical assistance. So we're lucky here in Philly that we have the city health centers and lots of other community health clinics that offer care to people regardless of their insurance or immigration status. Prescription assistance programs, charity care programs at hospitals and emergency rooms, all available to people for the most part, regardless of their status. Emergency rooms, definitely, but prescription assistance programs, I know that there are some that try to impose some immigration status limitations, but for the most part, all of those things are available to people regardless of their status. If you run through all of those, right, and you still have a client who has no health insurance option, who has a need for medical care that they cannot access without health insurance, well, now you might have an emergency medical assistance case and you need to start thinking about whether you have verification already of an emergency medical condition. And if you don't, if there's a provider who will help you get that verification. We'll talk much more about that part toward the end. If you want to move on to the next slide, I'm going to do a real quick overview of immigrant eligibility for medical assistance, because like we just went through, that's really a key part of this, right? First, you need to figure out if your client's immigration status gives them some option for regular medical assistance before you want to move on to trying to figure out if there's an emergency medical condition that can be verified. Verifying the emergency medical condition for people who have them is often the thing that hangs up these EMA cases. Verifying emergency medical conditions can be really tough, so we'll talk about that. We'll talk about what happens once somebody gets emergency medical assistance. How can they keep it? What happens if the county assistance office tries to shut them off? And then we'll talk a little bit about at the end about public charge and privacy, which are both big concerns for people who are thinking about applying for or using all medical assistance, but especially emergency medical assistance. So let's go on to the next slide. All right, so for that brief overview of immigration status and what kinds of medical assistance are available to immigrants, the first thing we need to run through as an overview are the different categories of immigration status that mean anything for public benefits law. So these are kind of the broad categories of immigration statuses that public benefits law creates when defining immigrant eligibility for medical assistance. So at the top here, we have lawfully present, which is by far the broadest category. It includes pretty much everybody that's in the US with permission, even if that permission is temporary. So it includes people with U visas, it includes people with temporary protected status, and includes pretty much everybody with employment authorization, including people who are applying for asylum. The big group of people it explicitly excludes is DACA. So people with deferred action are lawfully present for medical assistance eligibility purposes. But if you got deferred action through the DACA program, there's a special exclusion for dreamers within the definition of lawful presence, unfortunately. PRUCAL stands for permanently residing under color of law. This is also a pretty broad range of statuses and includes most people with more permanent or indefinite periods of permission to live in the US. Pretty much everybody whose PRUCAL is also lawfully present. I include it here because people, for example, there are a couple groups of people who are excluded from the definition of lawful presence who I think are included in the definition of PRUCAL, including folks with DACA. People with deferred action are PRUCAL, and there is no special exception made for DACA. And PRUCAL is still relevant for state benefits purposes, and we do have a state medical assistance program here in Pennsylvania. So here in Pennsylvania, PRUCAL is something that we still want to think about for DACA folks in particular. Qualified immigrants are the lucky few who kind of made it through that 1996 welfare reform law that did a lot to restrict people's eligibility for all kinds of benefits programs, including medical assistance, and it restricted immigrant eligibility a lot. So the folks who made it through, the folks that the federal government decided in 1996 are eligible for federal medical assistance benefits include people with green cards, VAWA petitioners, parolees. Parolees are people who have been paroled into the US for at least 1 year. And then humanitarian immigrants, and our humanitarian folks include refugees and asylees, also includes people with withholding of deportation, people with T visas, and Cuban entrants. Next slide, please. So this is a visual representation of all those groups, just to give you an idea of how they kind of interact with each other. You'll see here I said that pro-call is almost entirely a subset of lawful presence. But there's that little sliver of folks who are pro-call but are not lawfully present, including DACA, which is it's just that little sliver of folks here, that those are the folks that we are really concerned about when, and the only reason that we even talk about pro-call anymore is for those folks in that sliver outside of lawful presence. Next slide. So we have, like I said, we have these two medical assistance programs in Pennsylvania. We have federal medical assistance and we have state medical assistance. The federal medical assistance programs that we have are those programs that are funded both by the federal government and by the state government. And because these programs are funded in part by the federal government, federal law applies to these programs. I didn't include this here in the brief overview, but to give you an idea of what I mean when I say federal medical assistance. Federal medical assistance is available to kids and pregnant women, the expansion population, so the groups of adults who became eligible once we expanded Medicaid in Pennsylvania, adults up to 138% of the federal poverty line. People with disabilities who are eligible either through the Healthy Horizons or the MAWD, the Medical Assistance for Workers with Disabilities program. All of those are federal medical assistance. So in order to access any of those federal medical assistance programs, you also have to have one of these immigration statuses listed here. You either have to be a US citizen or you have to have one of the statuses listed on this slide. So lawfully present pregnant adults and children under age 21 can get federal medical assistance. Qualified immigrants who have been in the US with a qualified status for at least 5 years can get federal medical assistance. And then qualified immigrants who have been qualified for less than 5 years, but who are exempt from the 5-year bar, can also get federal medical assistance. Next slide. The 5-year bar, which I'm sure you all have heard about before, is this 5-year waiting period for qualified folks. The people who are exempt from that 5-year bar, so the people who do not have to wait those 5 years, include humanitarian immigrants, so refugees, asylees, Cuban entrants, T visa holders do not have to wait the 5 years. Kids and pregnant adults do not have to wait 5 years. People who have been continuously present in the US since 1996. We don't see too many of those anymore, but every once in a while one pops up. And then folks with military history. The people who do have to wait include green card holders who entered on family petitions. When they get here with their green cards, they have to wait 5 years before they become eligible for federal medical assistance. Diversity lottery winners and VAWA petitioners. VAWA petitioners really confuses people often. I think folks tend to think that VAWA petitioners should be like humanitarian immigrants, and in many ways they are, but for this purpose they are not. They are stuck in that 5-year waiting period. Once they get the prima facie determination back, that 5-year bar clock starts ticking, but until it's ticked away, until those 5 years have passed, they're gonna be stuck in that 5-year waiting period for federal MA. Next slide, please. So in addition to the federal MA programs, we also have state-funded medical assistance. This is medical assistance completely funded by state dollars. It's a pretty small program. The main reason it's so small is because the income limits are very low. For most people need income around, the income limits do not get any higher than about 45% of the federal poverty line. That's 4 or 5, so less than half of the poverty line. So these are very poor people, but for those folks who meet those income limits, it can be very, very helpful because the immigration status rules are much less restrictive than they are in the federal MA programs. So there's no 5-year bar for state-funded MA. You only have to be lawfully present. And even crew calls have some access to state-funded MA. And I put this site here to actual Pennsylvania law because unfortunately the handbooks that the county assistance offices use don't mention crew calls at all. So for example, if somebody with DACA went into the county assistance office to apply for state-funded MA, they would probably be denied because of their immigration status, and they would have to advocate to get their medical assistance turned on under this provision in state law. But the provision in state law is there. I'm happy to have that fight if needed. So if you know folks in that particular boat, please feel free to reach out. Next slide. All right, so who are we left with? Who are the folks who don't have a medical assistance option because of their immigration status? Well, undocumented folks, clearly, right? We haven't even mentioned them yet. They will always have an immigration status problem to their eligibility for medical assistance. Crew calls who are not eligible for state-funded MA, perhaps because their income is too high. Lawfully present adults who are ineligible for state-funded MA, perhaps because their income is too high. And then qualified immigrants subject to the 5-year bar who are not eligible for state-funded MA. For the lawfully present and the qualified folks, remember the marketplace, of course, still exists and it's still an option. There is no 5-year bar for the marketplace. You only have to be lawfully present to access the marketplace. So that is an option for those groups. Next slide. But for all of those people, all of the people listed on that last slide, their only medical assistance option is emergency medical assistance. So undocumented folks, people stuck in the 5-year bar for federal MA who can't get state-funded MA. Emergency MA is the only option. All right, so they have to meet all of the MA eligibility criteria that anybody else does, except that they don't have to meet the immigration status eligibility criteria. And then they also have to prove that they have an emergency medical condition. Next slide. So what is an emergency medical condition? Well, that's a great question. This here is the definition copied and pasted straight from state and federal law. It's really it's all that we have. All that we have from the federal government, all that we have in law, really, that says what an emergency medical condition is. And each state has some leeway when deciding what these words mean, right? So a lot of the advocacy that CLS has been involved in over the years has been around convincing our state Department of Human Services to interpret this definition as broadly as possible so that as many people as possible can get emergency medical assistance. I've highlighted here the parts of the definition that I think really hang the most people up and that lead to the most wrongful emergency medical assistance denials. So just to read it through, an emergency medical condition is a medical condition manifesting with acute symptoms of sufficient severity, including severe pain, such that the absence of immediate medical attention could reasonably be expected to result in one of these serious health consequences listed here. So placing the patient's health in serious jeopardy, serious impairment to bodily functions, or serious dysfunction of a bodily organ or part. So we're going to walk through, I hope that you all have, if you don't, I'll be sure to send it to you after today, the emergency medical assistance principles. And I'm going to walk through kind of each of these highlighted parts of the condition, of the definition of emergency medical condition here. and refer to the principles as I'm kind of explaining what these parts of the definition mean. The principles, yeah.
Oh, I'm sorry to interrupt you. I attached all of those documents to the calendar invite, so if people are looking for that.
Cool. So yeah, if you can pull them up, if not, you know, you can take a look at them later. The principles are the result of a whole lot of advocacy that CLS and the Community Justice Project in Harrisburg has done over lots of years, many years, on emergency medical assistance. And we've really tried to break down this definition into its smallest parts to give us as much opportunity as possible to get each individual case approved. So, so let's move on to the next slide. So first, a condition manifesting with acute symptoms. If you take a look at the principles, specifically principle 3, you will see that we have a principle there that says that the condition itself does not need to be acute, right? It's the underlying chronic, it's the underlying condition. It's the underlying, as long as the underlying condition manifests with acute symptoms, that underlying condition can be an emergency medical condition, even if that underlying condition goes on for years and years and years, even if it goes on for an entire lifetime. The underlying chronic or ongoing condition can be an emergency medical condition, regardless of how long it's going to last. Note that the law, the definition in the law itself identifies severe pain as a qualifying symptom, and there are lots of people with lots of pain. So if you have a client who is in pain, that could be, you know, all that you need to show that there's an acute symptom there. The symptoms do not need to be acute at the moment EMA is approved. I like seizure disorders as an example of this. A seizure disorder is something that goes on for a very, very long time. Sometimes it goes on for a person's entire life. And the seizure itself is the acute symptom. But you never know when it's going to come. You never know when it's going to go. You don't have to be actively seizing in order to have an emergency medical condition. You just have to have that underlying condition that manifests from time to time with an acute symptom, as a seizure in that case. An acute symptom may be one that shows a marked deviation from the norm, regardless of how long that deviation took to manifest, right? So if you're maybe like a diabetic, right? If you there is a normal kind of sugar level, and if your particular client is now kind of over the last year or so, their sugar levels have risen to a place where now we can call it a marked deviation from that norm, even though it took a year for that person to get there. If it is now a marked deviation from the norm, that is an acute symptom. Acute symptoms manifest in lots of different ways, and sometimes they are manifesting in ways that are not even apparent to the person who's experiencing that symptom. So for an example, if there's some kind of growth inside your body, it might be that the only way you know that that's happening is through imaging, right? Through an MRI or something like that. Or even with like something like a blood sugar level, it might be that you need lab work to show that acute symptom is happening. So in those cases, sometimes we are able to get the emergency medical assistance turned on so that people can get that lab work or imaging that people need to prove that the acute symptom is occurring. Next slide, please. So you have to have a condition with acute symptoms and a need for immediate medical attention. Medical attention is a really broad term. It can include stuff like surgeries. Can also include regular doctor's visits or medicines that people need to pick up at the pharmacy once a month. It can include any of that. The medical attention that somebody needs has to be immediately needed, but it does not need to be immediately accessible. This seems like a crazy thing to have to point out, but I can't tell you how many times I have had to point out to the Department of Human Services, to the doctors who work for the Department of Human Services, that just because somebody needs a surgery doesn't mean they can just go get it whenever they want it, right? We do not live in a world with a healthcare system that allows people to get surgeries on demand. It seems like a crazy thing to have to point out, but oftentimes we do need to point that out, and pretty explicitly need to point it out to the folks at the Department of Human Services. The specific course of treatment does not need to be known in order for an emergency medical condition to exist. In lots of cases, the first thing you're going to need is testing, right, to confirm what the thing is before you can figure out what treatment is actually needed. And in those situations, the testing is the immediate medical attention, is the first part of that immediate medical attention that the emergency medical condition necessitates. Next slide, please. Okay, and then the last part that we have seen cause trouble in lots of cases is this reasonable expectation part. So you have to have an immediate need for medical attention, and there has to be this reasonable expectation that there's going to be a serious health consequence without that medical attention. The first thing that seems pretty obvious, but that what we have really had to convince the Department of Human Services about, is that this is a future-looking test, right? A person does not need to be currently experiencing that serious harm, that serious jeopardy to their health, or the serious dysfunction of a bodily part or organ in order to have an emergency medical condition. What you need is a medical provider that has a reasonable expectation that that serious health consequence is going to occur in the future. And if you look closely at the definition, there is no time frame at all for when the serious harm must be expected to occur. The word immediate refers to the treatment needed, not when the serious harm is expected to occur. I think we see this a lot, perhaps in like cancer cases, right? If you have cancer that's at a certain point in its progression, you need to treat that right away. And if you don't, that person could die. Like your medical provider has a reasonable expectation that you will die. You're not gonna die tomorrow. You might not even die next month or in the next 3 months. But an oncologist will have a really reasonable expectation that if you don't start treatment quickly, you will die within the next 6 or 12 or whatever, however much time in the future it is. Just having that reasonable expectation of the serious harm happening at some point in the future is enough. Speaking of the provider's reasonable expectations, the Department of Human Services does not expect doctors to have little crystal balls, right, that they pull out to say for sure that that without treatment, the serious health consequence is certain to occur. Nobody can say that, right? It's really just about that good faith, reasonable expectation of the medical provider. I mentioned death as a potential serious expected harm, but it does not need to be death. It can be serious dysfunction of any body part or organ, even if that body part is not life essential, like an arm or a leg or an eye. We've had some luck recently getting EMA for different kinds of eye surgeries, cataracts, stuff like that. So keep that in mind. Next slide. So through a whole lot of advocacy, those principles, I should say, have been approved by the governor's office. So the Department of Human Services is under instruction from Governor Wolf's office directly to use those principles when making emergency medical assistance decisions. We've seen kind of results all over the place on that. And there are cases where the principles are not followed, and we need to advocate to make sure that they are. But for the most part in Pennsylvania, we are able to pretty easily get emergency medical assistance covered, or emergency medical assistance authorized to cover things like cancer, a whole variety of surgical procedures, dialysis, repair of broken bones, high-risk pregnancies, medications that people just need to pick up at the pharmacy once a month for things like immunosuppression for people who have received organ transplants and need to take those immunosuppressant medications to keep their body from rejecting their transplanted organs. Those folks need to take those medicines their entire lifetimes. We are able to get EMA approved for that. Also anti-seizure, I mentioned seizure disorders. We've had good success getting EMA approved for seizure disorders so that people can get their anti-seizure medications. Insulin sometimes for people who are insulin dependent diabetic. Labor and delivery is always an emergency medical condition. And then a whole bunch of other stuff. I couldn't list everything here, but everything that's listed here, we are able to fairly easily get at this point. Next slide. Coronavirus is an emergency medical condition, and this we got this news from the Department of Human Services last week, and I know that since we've got this news, there has been a lot of talk about this in the media because the federal legislation that's coming, that has already been passed and that's coming down the pike includes or excludes, and so far there has been nothing in the federal law yet requiring states to provide emergency medical assistance for coronavirus testing and treatment, but states can still opt to do it. Like, this is still a discretionary thing for states, and here in Pennsylvania, they have opted to say that coronavirus is an emergency medical condition. So the stuff in the news and in the media, I fear, will be really confusing for people. And folks here in Pennsylvania might think that they can't get EMA for coronavirus because it's not in that federal law, but that's not true. Pennsylvania has decided to do this on its own, and it can do that. It's allowed to do that. So coronavirus testing, diagnosis, and treatment is available here in Pennsylvania through EMA. I should also say that since I made these slides, we have also heard from the Department of Human Services that they will just take an individual statement. So the person who's applying for emergency medical assistance can write on their application that they need coronavirus testing, diagnosis, or treatment, and that's all that they should need to verify the emergency medical condition. They don't need to get a form or anything done by a doctor. So that's really good news. Next slide, please. So now you know a little bit about what an emergency medical condition is, but how do you prove it? This is where these cases get especially tricky. I have put on this slide here what Pennsylvania law says about what you need to do to verify an emergency medical condition, and it's very simple, right? All you need is a written statement from a medical provider that says what the nature of your emergency medical condition is, what the treatment is that you need of that condition, and how long the condition is expected to last. Really simple. And if you go to the next slide here, hopefully, yeah, this is a not great copy of the emergency medical condition information eligibility form. So this is the Department of Human Services form. Should also be, I did send this to Gwen. If you all don't have it, I can send it again later. Or if you haven't seen it already in your own caseloads. You'll see, if you take a look at it, if you can read it on this slide, this form does everything that the previous slide says that you need to prove an emergency medical condition. It gives a place for the provider to say what the condition is, state the diagnosis, state the nature of the emergency medical condition, It has a place for the provider to state what treatment is needed, and then it has a place for the provider to put the duration of the emergency medical condition treatment. So this form alone meets the standard set by Pennsylvania law for verifying an emergency medical condition. Next slide. Unfortunately, the Department of Human Services very regularly ignores that law that says that all you need is the statement from the medical provider and insists on more. Emergency medical assistance applications are submitted at the county assistance office just like every other medical assistance application. But the county assistance office isn't making the decisions about whether an emergency medical condition exists. The county assistance office sends everything that they get about an emergency medical condition and sends it up to the Office of Medical Assistance Programs in Harrisburg for clinical review. And there's a group of doctors that look at the form and makes a decision about whether there's an emergency medical condition. OMAP, the Office of Medical Assistance Programs, will very often ask for medical records to support the form, and then often, even if medical records are then provided, OMAP will still deny emergency medical assistance and will disagree with the provider that filled out the form and say that there is not an emergency medical condition that has been verified through the form and the records. Or sometimes they will approve, but they'll approve it for a really short period of time, even though the doctor on the form has said, if the doctor has said on the form that the person needs 6 months of treatment, OMAP may deny or they may approve for 2 months of treatment. Every once in a while, they will approve for the full amount of time that the doctor has put on the form, but we very often see cases where OMAP has either denied altogether or has approved for a shorter period of time. Next slide. For those cases that are approved, folks are not enrolled in managed care. So almost every single medical assistance recipient at this point is enrolled in managed care. So they are getting their medical assistance services through Keystone First or Health Partners or one of the other managed care organizations. But emergency medical assistance recipients, their care is paid on a fee-for-service basis. Their access card, their yellow access card, is their health insurance card. It's the only card they're going to get. Generally, the Department of Human Services, OMAP specifically, will not authorize EMA for any more than 6 months at a time, right? So even those folks who are approved for the anti-rejection medications that I said people can very easily get approved, and they're going to need anti-rejection medications for their entire lifetimes, even those folks are approved in 6 month increments. And so every 6 months, they need to submit another form from their doctor that says, yep, I still have that donated organ and I still need the anti-rejection medications. So please give me another 6 months of EMA, which is very frustrating. And it's one point that we continue to advocate with DHS to change. For those folks who are approved, what's supposed to happen is before the end date of their EMA approval period comes, they are supposed to be reviewed. Their case is supposed to be reviewed to figure out if that emergency medical condition persists, if it's still going on, if there should be a new EMA eligibility period authorized. But this gets screwed up a whole lot. The county assistance office does a really bad job of telling people that these renewals or these reviews of their cases are supposed to happen. So we really encourage people, if possible, to track their scheduled emergency medical assistance end dates and to get documentation in before that end date comes around, and ask for a new EMA eligibility period if their emergency medical condition is going to continue past that scheduled close date. Next slide, please. So EMA approvals that are approved for 2 months or more are opened as ongoing cases. So an ongoing medical assistance case cannot be closed lawfully without an advance notice to terminate medical assistance. So if somebody's been approved for 3 months of emergency medical assistance, that emergency medical assistance cannot be closed when that 3rd month end date, when that 3-month end date comes. Lawfully, it cannot be closed until the county assistance office sends an advance notice to terminate. An advance notice to terminate is a notice that is sent before the closure that says, we're going to close you, we're going to close your emergency medical assistance on April 1st. And the really good thing about that is that an advance notice to terminate comes with the right to appeal while keeping your benefits active, right? So if you get an advance notice to terminate, you get that appeal in before the termination date, before April 1st. If the notice says we're going to turn you off on April 1st, if you file an appeal before April 1st, you get to keep your medical assistance on while that appeal is pending. Emergency medical assistance approvals of less than 2 months are approved as non-continuous eligibility periods. So this is considered just a closed period of medical assistance eligibility. The medical assistance can close without any advance notice to terminate. The initial notice of eligibility, so if somebody submits an EMA application, the Office of Medical Assistance Programs determines that the emergency medical condition will last for 2 months. There will be a notice issued to that person that says you are approved for EMA for 2 months, and they'll list the dates. So it could be from February 1st to April 1st, you will have emergency medical assistance, and that's the only notice they'll get about their eligibility period. They can file an appeal, but they won't be able to get that aid paid pending. They won't be able to get the medical assistance to stay on while their appeal is pending. It's a closed eligibility period. The other thing that we have seen happen in these EMA cases is these calls from what OMAP calls case managers. For emergency medical assistance cases that are approved for longer periods of time, we've seen them in cases that are approved for like 4 or 5 months or more. For some of these cases, OMAP will assign case managers. So these are OMAP case managers assigned to the EMA case. And we've heard about these case managers calling our clients, asking about how they're doing. Sometimes they will call medical providers directly to get updates on people's cases. We think this is wrong. What's most troubling to us is that sometimes these case managers, it seems, have used the information that they gather through these phone calls to make decisions about whether somebody's EMA should remain open or not, which we think is really problematic. So when our clients get these, we tell our clients that if they get the calls, they should just say, call my lawyer, call us, call me if I'm representing them, because we don't see that they're doing anything that's particularly helpful in these cases. Next slide. So I mentioned appeals already. If an initial emergency medical assistance application is denied, that denial can be appealed. If emergency medical assistance is turned on and then terminated, the termination can be appealed. Like I said, if it's an EMA authorization period of 2 months or more, people can appeal the termination. And if they appeal it quickly before the termination actually happens, then they get to keep their medical assistance on while the appeal is pending. And And then you can refer to us. We are happy to take these cases. They are tough cases, and we know that. We've done, like I said, we've done a lot of work advocating to kind of open up emergency medical assistance as much as possible. But that advocacy continues, right? We want to make it even more accessible to people, and the only way we really can do that is with cases. So we need folks to come to us for help, and we know that people can get really beaten down by these cases because they are so hard and they kind of give up. We don't want that to happen. Like we can get these cases approved sometimes, most times, maybe even. And like I said, just having these cases to talk about with Department of Human Services is really what keeps this advocacy moving forward for everybody. So we need them. I have a couple more slides on public charge and privacy. And we have more time. I've been talking for a long time. If people have questions, feel free to chime in at any time, or even now, before we move on to kind of a different topic. All right, well, let's move on then. So I think we have public charge. This is actually really easy. I'm not gonna do a whole public charge spiel here. I hope that you all know that the very, very, very large majority of people who can get medical assistance, who are eligible for medical assistance, can get medical assistance safely without any public charge risk at all, especially emergency medical assistance. Emergency medical assistance is very explicitly identified in the new public charge regulation as a type of medical assistance that is excluded entirely from the public charge test, right? So if somebody got emergency medical assistance, that cannot be counted against them. If they are subject to a public charge test, that cannot be counted against them when they're trying to pass that public charge test. And then for coronavirus, there's like a double protection. So emergency medical assistance can't be considered during the public charge test, and then coronavirus testing cannot be counted against, coronavirus testing and treatment cannot be counted against folks during a public charge test, even if medical assistance is used to access the coronavirus testing and treatment. So there's like a double protection there for people who are using EMA for coronavirus testing and treatment. Next slide. Privacy is a huge concern for people. You know, when it comes to people's fears to accessing public benefits, I kind of think public charge and privacy are two sides of that coin. They really work together to scare a lot of people away. I know that folks are really scared, and they think that as soon as they kind of make themselves known in any way to a government entity, that their information is somehow just kind of up for grabs and available to people like ICE, that ICE can use to find them and detain them. When it comes to medical assistance, that is not true. So there are very robust privacy protections built into Medicaid law that cannot be undone by the Trump administration. They're in statutes, right? So Congress potentially could change them, but Congress isn't doing anything to change laws these days. There has been no even whisper of anybody trying to change the privacy protections in Medicaid. So just to run through what those privacy protections do for folks, an emergency medical assistance applicant does not need to answer any questions about their immigration status or provide any documentation of their status at all, because emergency medical assistance is specifically for people who lack the immigration status that they would need to be eligible for regular medical assistance. They are not expected to provide any of that information when applying for EMA. They should never be asked, and you know, the fear of the rogue caseworker is legitimate, but I have never, ever heard of that happening at the county assistance office, where people have applied for EMA and have been told that they have to hand over some information or documentation about their status in order to get it. The only thing an emergency medical assistant should ever need to say about their status is that the status that they have makes them ineligible for benefits except for emergency medical assistance. This protects people, right? Because remember, it's not just undocumented people who are potentially eligible for EMA, it's also people with green cards who are subject to the 5-year bar, for example. All of those folks have a status that make them ineligible for benefits except for an EMA. An EMA applicant with a deportation should never be asked to provide a copy of that deportation order and should never provide it. Again, I have never heard of this happening. The reason I put this in specifically is because there is one little piece of food stamps law that says if the county assistance office gets proof from somebody that they are removable, and the county assistance office makes a determination that they are in fact removable, they're supposed to report that to immigration authorities. Now, like I said, there is no reason in the world why anybody should ever be asked to hand over a deportation order, and there is never a reason for anybody to ever do it. So I put that in there to kind of be really extra safe. But